Hello and welcome to the Valley. Today I am your host, Janet Michael. It is a special episode of the show today. I am sitting in the office of Chris Rucker. Chris is the Chief Administrative Officer for Valley Health, and we're going to talk about Medicaid today, Chris, because we're all seeing it in the news, and I worry that too many people don't understand what it is that they're hearing and what the problems are going to be if this big, beautiful bill passes in the next several days. So I'm hoping that you can educate me on all of those things.
Well, absolutely. Janet, thanks for taking time. And it's a special day for us too, because we don't normally have visitors like you. So we're really glad that you're asking these questions and we can share some thoughts with your listeners. Medicaid is a health program, an insurance, if you will. It's funded by both the federal and state governments. It's a combination. It is for the disabled, for women of childbearing age, for children, for the elderly that are indigent, and then really the smallest portion of the Medicaid population are indigent adults who can't afford to pay for their health care. And like many things that involve our taxes, involve federal programs, there's a lot of opinions out there about how they work, whether they're effective. And frankly, it's the kind of thing that, because it may not necessarily impact some people, some taxpayers, some constituents directly, they think that's a great place to cut the budget. And of course, as healthcare providers, we don't necessarily believe that's the case.
And that's always been my worry when these Medicaid conversations come up, is that people think, oh, I'm not on it, so it's not going to impact my life. And if they probably took 5 minutes to just look around in their lives, they're going to see somebody who is on Medicaid because they have a real need for it. They may have a friend who has a child that has special needs. They could have a friend who has a parent who's in a nursing home that can't afford the likes of some of the nicer ones. Medicaid covers some of those costs.
Absolutely right. Life hits us all a little bit different. Unfortunately, there are some retirees who need a little additional financial assistance in skilled nursing, and there are pregnant mothers that need assistance with their pregnancy. So in Virginia, there's over 500,000 children that are covered by Medicaid. So Medicaid serves as that safety net to make sure that 500,000 children get child visits, are getting on-time immunizations, are getting sports physicals when they need them, are getting assistance with any chronic disease such as diabetes or asthma. Think of all these things that we learn about sometimes with our children. And then a similar number, over 250,000, are disabled individuals or the aged or the blind that are receiving assistance. And so when we think about that, let's say that's between them about 800,000, that's about 80% of the people receiving Medicaid benefits in the state of Virginia. And the remaining 20% include adult caretakers of those that are requiring in-home assistance, and then very few individuals that are of working age but are unable to find employment, or their employment is insufficient to cover their healthcare needs. So about 80%, again, children, elderly, blind, and disabled or pregnant women make up the population.
That's a big number for the state of Virginia. You start to drill down into the Shenandoah Valley. There are several of your hospitals. Warren Memorial Hospital, for example, is in a rural community. People don't necessarily think of it that way, but that's actually how it shakes out. It's going to impact them even harder.
Well, that's really true. Oftentimes in the communities we live in, we don't necessarily see them as rural because we enjoy a smaller town environment. We enjoy knowing our neighbors and bumping into our friends at the Walmart on the weekend. But from a healthcare perspective, from the federal government's definition of rural, it's very difficult to recruit and retain healthcare professionals into these areas. And care in these areas is just frankly more expensive to provide because of that. So it is absolutely, and Warren, as you said, is an example of that, but there's even more rural examples like in Luray or
Shenandoah County,
Stanley, lots and lots of places that don't have ready access to health care without additional assistance.
You mentioned cost of care. I think that's another huge misconception out there. It's not as if Valley Health is telling the Medicaid system to pay me twice as much for this particular care of an individual. You're not even getting full face value out of pocket what it costs you to provide care. This isn't that.
No, it's not. And if you'll bear with me for a second, let me explain an example of knife, I guess, that cuts both ways. So the federal government says hospitals that take payment from federal programs like Medicare and Medicaid are required to see all patients regardless of their ability to pay, to provide a medical screening exam and appropriate follow-up, next care, transfer to a physician, etc. And of course, that's our mission. That's what we do regardless of a law or a regulation. That's why we're here in our communities. We're the safety net for our community's healthcare, and we sincerely embrace that. But it's funny that they make that rule, and then for Medicare and especially for Medicaid, they don't even pay what the cost is to provide that care. So they make a law that says you have to see these folks, but they set the rates and say, but we're not going to pay enough to even fund what their care is. We've heard recently terms like waste, fraud, and abuse, and some of that is around some of the mechanisms by which hospitals are reimbursed for the care of Medicare and Medicaid patients. Medicaid specifically, Virginia has a very well thought out program to get additional federal matching dollars with state matching dollars to get closer to the actual cost of providing care for Medicaid patients. And really, that's what hospitals are interested in maintaining, is just give us enough to continue to care for these patients that are in our communities, that are our neighbors, that are the folks that we work with, and our family members.
We talk a lot in my conversations with other Valley Health professionals about you being a nonprofit hospital. That's the whole point. It's not like at the end of the day, you're looking to drive a nicer car. Mark Nance doesn't want to go to Switzerland on vacation on the dime of Medicaid. That's not how it works at all.
No, not at all. And
although if he's going to Switzerland, I wouldn't mind to tag along.
He will need a media liaison to go with him.
I think you're right.
Absolutely. You're referring to Mark Nance, the CEO of Valley Health. Yeah, I would say probably one of the most poorly understood concepts in our community, if not every community, is when we say a nonprofit health system, really what that means is tax exempt. And so instead of paying income taxes like a business normally would, we're required by the IRS to spend all of our profits back into providing health care. And so we do make a profit. That profit is invested back into providing care for uninsured individuals or addressing unmet community health needs, such as housing, food insecurity, literacy, education for families with newborn children, helping support the medical clinics that are providing care to those without insurance. We do that in a number of ways, but when we say not-for-profit, there really isn't any money left over at the end of every year once we pay all the bills, and whatever is left over has to get spent right back into providing care. Unfortunately, not any big ski trips to Switzerland, like you said.
We're going to take a quick break and come back with the rest of our very frank conversation with Chris Rucker. He is the Chief Administrative Officer for Valley Health. We're talking about the local impacts that cuts to Medicaid could have to thousands of people across our region. In just one day, you can help shape a stronger, more connected community. On September 19th, United Way of Northern Shenandoah Valley will lead Day of Caring, the region's largest single-day volunteer event. Over 900 volunteers will roll up their sleeves to help local nonprofits with projects that matter. Painting classrooms, repairing shelters, planting gardens, organizing food pantries. Whether you're a business looking to sponsor, a nonprofit in need of an extra set of hands, or a neighbor ready to serve, there's a place for you on Day of Caring. This is what community looks like when we come together. This is care in action. Learn how to get involved at unitedwaynsv.org/dayofcaring or email dayofcaring@unitedwaynsv.org. One day, hundreds of hands, lasting impact. Join us. Welcome back to the Valley today. I am your host, Janet Michael. The conversation that you're hearing today with Chris Rucker, Chief Administrative Officer for Valley Health, was actually recorded last week before the Senate passed their version of this so-called Big Beautiful Bill. With that, even more cuts to Medicaid have been proposed than was in the House version of the bill. So as you listen to the rest of my fairly stark conversation with Chris, please consider reaching out to your elected officials to let them know your thoughts on this bill. It's not too late to have your voice heard. Even if you don't think it will help or you've never reached out to them before, please try. Their contact information is in the show notes at thevalleytodaypodcast.com. This bill is going to have an impact on all of us. People we know, people we don't know. It's going to impact our lives in some way, directly or indirectly. So please, make the effort. One of the recent statistics that I saw, Kim Wilt is our Director of Development and Advancement at United Way, and she pulled together a report for me on what this big, beautiful bill, what the outcomes were going to be in all the different areas, from housing, all these different things. And there are a lot that are going to hit people right here in their backyard. Sinclair Health Clinic, when you talk about free medical clinics, they're going to be particularly hit hard if these cuts go through, because we're not just talking about cuts. In some cases, we're talking about removal altogether from Medicaid.
Absolutely. That's the thing that's most scary, is people who right now are on Medicaid are going to be pushed off the Medicaid rolls. It's hard to forecast what that is because it's sort of a moving target as these bills keep changing what they'll cut and how they'll cut. But our best estimate is about 50,000 people in the region from Winchester to Luray, Warren County, Shenandoah County, Clark County. About 50,000 people are at risk for losing their health insurance, losing their Medicaid coverage. That again includes the elderly, it includes children, it includes disabled individuals. And that's the piece that we don't hear anyone speaking up about or our elected officials really addressing directly.
So let's talk about that part of it for a second, the advocacy side of it. Valley Health as a whole has been very vocal about where you stand and your ability to protect and take care of the communities that you serve. So where do our elected officials stand on this particular case? Are you having conversations with them? Are you providing them with these numbers? I can't imagine they want to go into a vote not knowing what the real repercussions are going to be, although some of them may prefer to go into a vote without knowing what the real repercussions are going to be.
Yeah, that is possible. So a big part of my job is helping make sure that our elected officials do stay up to date on healthcare in the region, what the challenges are for healthcare with their constituents, how we can work together to address those. I'm pleased to say both our state senators, Senator Kane and Senator Warner, are very aware and monitoring all this very closely, and their commitment, we take them at their word, is to do as little as possible to harm these vulnerable members of our population. Again, the children, the disabled, the elderly. But there are also a lot of elected officials who are likely to vote along party lines and do as they're led to do by their party leadership. And frankly, that's a little bit of what scares us, is people making decisions that impact healthcare, access to healthcare for individuals without thinking about what the repercussions of those decisions are.
We're not talking here about someone not having the ability to buy a new car. We're talking here about the ability for someone to see a doctor, for someone's child who has a disability to get a Medicaid waiver, to be able to have a daycare option, for them to still be able to work and their child to be taken care of during the day. These are real life crises that we're talking about here. So how is it not that Ben Klein, for example, our local elected official, isn't walking around asking people, hey, how is this going to impact you? Or has he talked to you and I just don't know about it?
Well, specific to Representative Klein, I know that he is aware of the situation. We have spoken with him. We've shared what we believe to be the impact of proposed cuts, the impact to healthcare for Virginians and for his constituents here in the community. And ultimately, I guess we'll see when the bill makes its way back to the House, we'll see how Representative Klein takes that. Now, there's probably a philosophical question here to be answered, and that is, do we believe as a nation, as our people, is it part of our culture, is it within our DNA, if you will, of who we are, that we take care of each other? And does everyone have a right to health care? Does everyone have a right to food and to water and to shelter? And healthcare is the most essential right of all that, making sure that people have access to that which is most essential to their survival: food, water, shelter, healthcare. But we tend to draw the line there for some reason. As a society, we tend to think, oh, that's not something that we should work to provide for everyone.
They think of it as an extra.
When there's cuts, we will still have to provide care for these individuals, oftentimes in not the most economical way. So let's say that somebody loses their Medicaid, they're unable to go see a doctor, whatever their chronic conditions are, those get worse. And they end up in the emergency room in the ICU instead of being cared for through their primary care office. So there's a ripple effect that makes the population sicker and ultimately more expensive to care for, not less expensive. This is why your doctor wants to see you every year and do a checkup, because it's the right thing to do, because it's good medicine. And the other piece is, if, for example, in our region, there's the potential, let's say $90 or $100 million in Medicaid funding that might go away, that might disappear under some of the proposed legislation, without knowing certainly, that's got to impact employment. We don't have at Valley Health $100 million worth of belt tightening we can do. We're going to have to figure out how to do more with less, more with fewer people. And as the largest employer, and really as any large employer, there's a trickle through the community. If people lose their job, then they don't have money to spend in the grocery store, and they're not paying their babysitter, and they're not paying the guy that mows the lawn or whatever. And then the guy that mows the lawn doesn't have as many lawns to mow, and he doesn't have money to put food on the table. And healthcare is a significant economic driver. We spend millions of dollars with local vendors every year, and of course, our employees are responsible for about $600 million in spending back into the community with their paychecks.
And that takes us back to where we started with this conversation, that just because someone listening today isn't specifically on Medicaid doesn't mean that it's not going to impact them if these cuts come through, because your emergency rooms are going to be fuller, faster, longer, which means when I fall and break my leg, or I have some crisis at home, a mental health breakdown, which could probably happen sooner rather than later.
You're at the right place.
I'm very happy that at least I'm on the Winchester Medical Center campus today. But it impacts me in that wait in the emergency room. It impacts me in all of these other areas. It should matter to me.
Absolutely. Healthcare is an ecosystem. I mean, healthcare is really all in balance. It's some people paying for the care that they can, some people paying through Medicaid, again, less than what it costs, but at least contributing, and a very, very small portion of folks that are unable to pay, they don't have insurance, or they choose not to pay. Now, if you grow that group, you take people off Medicaid, but they still don't have insurance, that really throws the system out of whack. Mm-hmm. And you've got longer lines, you've got longer waits, you've got frustrated individuals who have insurance that say, why do I have to wait? I have insurance. Why am I waiting in line behind somebody who doesn't have insurance? So it's absolutely a win-lose proposition for all concerned.
So let's talk about outcomes. Worst case scenario, this bill passes. These cuts go into place. These removals start happening. Is that going to be immediate? Is that going to take a year or two to shake out? And then what is that going to look like in our community?
Likely as not, the immediate effects would start with the new fiscal year in October. Some of the legislation that's been proposed stair steps some of the cuts, so softens it, if you will, or makes it a slow death instead of a fast death for some healthcare systems, for some hospitals. But I think we will begin to feel the impact within a few months. And that impact will translate down to the front line, to the bedside, sooner rather than later. I think 5 years from now, it'll seem draconian in hindsight.
There are hospitals that could close across the Commonwealth from this bill being passed. Not Valley Health in our immediate future, but there are hospitals in even more rural communities in the state of Virginia that could close by the time this all shakes out.
Yeah, sadly, that is the case. Hospitals, remember I said, are not for profit, means they don't pay taxes. Hospitals often run at about a 1 or a 2% margin, profit margin. I said that profit then gets respent back into the community for healthcare, but that's 1 penny out of every dollar that's left over at the end. 1%, 1 penny out of every dollar that came in, that's a really, really thin operating margin to be able to navigate. So if you take a rural hospital or a hospital that is already struggling and you cut 20% of their funding, it is impossible. That community will more than likely not have a hospital, and without a hospital, many of the physician offices will close, the doctors will move away, and they will become healthcare deserts.
Is it too late for any of us to do anything? And if not, what can we do?
It's never too late. And I think the most important thing to do is to let your elected officials know that you're concerned about this, let them know the importance of healthcare access, both because it's the right thing to do, it's who we are as a nation, but also because it's good for our communities, it's an essential part of our local economy, and having a bunch of people that don't have access to healthcare, which causes a trickle-down effect of people losing jobs, other folks, other businesses and small businesses closing, it's just catastrophic. So you've got to stay in touch with your legislators. If you go to their individual pages at ushouse.gov or ussenate.gov, you'll be able to click a link on everybody's page and tell them how you feel, or pick up the phone and call and leave a voice message at their office. Believe it or not, even in this day and age, and there's nearly 400 million of us here in the nation, our elected officials do listen when their constituents call. They want to hear from us, and if we're just not being responsive, they're going to assume they're doing the right thing. So we've got to speak up.
Yeah, this is not a case where silence is golden.
It's not. And please don't get lured into maybe how it could be spun by some people, meaning the words twisted around. Like if you say waste, fraud, and abuse, it sounds like, well, anything we do to eliminate that must be good. But we've got people in rural communities, let's say that one of the solutions is they've got to have 80 hours of work a month. That's in some of the most recent legislation. Well, we have communities that just simply don't have any jobs. More than half the population leaves that community every day for employment. And if you're unemployed, working in a non-regular employment and not getting a regular paycheck, not getting benefits, etc., maybe you don't have transportation, you're using public transportation, or you're riding your bike, or you're walking to work, the idea of leaving your community to get 80 hours worth of work a month is impossible. So when you get down to the nuts and bolts of even how some of these proposals that sound on the surface like, well, that makes sense, I'd support not having fraud and abuse, it's really how you define it. It's understanding what's underneath it. And underneath every single one of these decisions are human lives, our children, are the disabled, our neighbors, our friends.
And that's where I think personally, and this is Janet on her soapbox, that this administration in particular, and probably previous administrations, have fallen down because they're going in with a blowtorch instead of going in and taking a look at where is the actual problem. So even if there is waste, fraud, and abuse, you don't cut the head off the snake in order to find it. You don't go in and shut down entire federal agencies because you think maybe somebody is not really working from home when they say they are. Spend the time to actually learn and get in the weeds in your community. Then you'll know what's working, what's not working. And I'm guessing you probably could provide a list of, if you did it this way, it would be so much easier and you'd be able to track it so much better. That's what partnerships are all about.
Absolutely. Healthcare is probably the most complicated part of our society, of our economy. It is absolutely very complex. And so since it's not easy to understand, it's easy to conflate, it's easy to mislead people, it's easy to spin things a certain way. And you said getting on your soapbox, and I'll just get halfway on mine. But the sad reality is the more rural parts of our region carried the current administration into office and the current elected officials into office. And those are the people now who are wanting to cut your health care. 40% of rural Virginians are covered by Medicaid. So 4 in 10 people have the potential to lose their health insurance coverage. And probably, if there's a zinger to add at the end of all this, is the people that are debating how to pay for your health care all get health care paid for by the United States government.
That was going to be the irony. When you were saying that, I'm thinking, yeah, don't they all get like this primo health policy?
Yeah, I think maybe if we put them on Medicaid for a while, maybe then they'd have a different view.
Do the old thing where the judge makes the landlord go live in the building for a while to just understand and realize what his tenants are going through.
Absolutely, absolutely.
Is there anything else that we haven't covered that I haven't asked that you feel like people should know?
Well, we really appreciate your interest in this and thinking ahead of what's important for your listeners. Your listeners are healthcare constituents. They're our customers, our patients, people that we care for. And before long, it will be too late. The damage will be done. It's irreversible. And so we do need, as soon as possible, as quickly as possible, for people to reach out and ask their representatives or senators to please preserve healthcare access in Virginia.
I will put links to all of the elected officials' pages, phone numbers, all of that in the show notes page at thevalleytodaypodcast.com. So anyone listening today, you don't even have to go look for it or find it. It's all going to be in the show notes because it's very important to reach out and let them know exactly where you stand. Chris, thank you for taking some time today.
Of course. Thank you very much.
I will be back tomorrow with a brand new episode of The Valley Today a few minutes after noon, so meet me here then.